Hi, my name is Katie Rietta, and I'm an application specialist with DermaSpark. And today we're going to be talking about cryotherapy. Now, cryotherapy is the gold standard, basically, of lesion removal that's available to us today. It is a very safe way of removing lesions such as keratosis, skin tags, hyperpigmentation spots, not diffuse pigmentation, and other types of benign lesions. Up to now, there's been a variety of methods of lesion removal, and some are for instance, would be laser. Lots of clinics use laser to get rid of like moles and skin tags, etc. The problem with anything that burns the skin, especially in lesion removal, is the fact that you create a lot of plume, which the technician and the client will be inhaling. And in some cases, if the lesion was viral, for instance, that would not be a very healthy thing. There's burning of them with laser. There's also electrocoagulation with radiofrequency. That's a very common tool in the marketplace to get rid of a variety of lesions. Especially that particular technology is really great for small vascular lesions, angiomas, things like that. It really is pretty adequate when it comes to getting rid of skin tags as well. The issue with that is the fact that it's hot. It's burning the tissue and causing necrosis with heat. And the side effect of that is, depending on the skin type, you can end up with scarring and burning. And if you're getting rid of a lot of skin tags, especially in the underarm or a sweaty area like that, it's going to be really uncomfortable for your client. So we represent two different devices. One is the FreezePen, the other with CyroProbe, and both of these deal with lesions in a very different way. They use nitrous oxide, which is a gas, and it's compressed gas. And so you're using it like a pen, and you're going to freeze the lesion. And what happens, the recovery of this is quite slow, actually, but the benefit of that is it usually leaves the client in a super comfortable manner, and it just sheds over the next couple of weeks, and the chances of scarring or any kind of adverse effect is really reduced. Now, why do we use nitrous oxide? Well, just like there is a variety of ways of getting rid of lesions in the market, there's also a variety of gas type technologies to get rid of lesions on the market. For instance, CO2. There's like CO2, something like you would get at Walmart, that they use that for wart removal and things like this. You can buy them commercially even at the store. They operate roughly at about minus 60 degrees Celsius. It could be a little bit more depending on the compression of the tissue. And the temperature you need to cause necrosis or cell death with cryotherapy is roughly the same temperature. It's about minus 60. Well, the problem with CO2 is it's not very strong, because you have to hit that sweet spot of minus 60 to cause necrosis, and you have other factors that interfere with that, like ambient temperature and stuff. A lot of times CO2 just isn't really a great method of treating something that's deeper or a little bit more substantial. So low CO2 it's safe, but it's not particularly effective because it's running too close to the actual temperature of lesion removal. So we use nitrous oxide, and there's another gas on the market called nitrogen, liquid nitrogen, which a lot of derms use. Well, the nitrous oxide runs at minus 89, which is well beyond the temperature of necrosis, but it's nowhere near the minus 89 degree, minus 189, or almost minus 200 degrees Celsius that nitrogen is. Nitrogen, if you've ever gone to a dermatologist and had those lesions removed with that, you almost get a big blister, and it's you can end up with a hole, an indentation in the tissue, because it was overkill. So we use nitrous oxide because it's stronger than CO2, but it's not as aggressive as nitrogen. So it's in that sweet spot. It's going to cause necrosis. It's going to create cell death, and you're going to have the shedding of the lesion, but it's not going to be super aggressive that it's going to take longer for your body to heal. Now, how does it create cell death? It freezes. It freezes the water of the tissue, which then ruptures the cell, and it's like frostbite almost in some ways. It ruptures the cell, and the cell will, once it thaws out, your body starts to absorb it. It typically looks like dry skin afterwards, and it can take 2 weeks. I've even seen some hyperpigmentation lesions take 3 weeks to recover. Typically immediately after, if I was doing a pigmentation spot, you're gonna see it almost like IPL, it's gonna look darker. And if you're doing something like a skin tag or other type of lesion like that, it often looks just like a little mosquito bite. So that's sort of the after effect of the treatment, and that can take a few weeks for it to heal. And but it's very comfortable. Might be a little itchy in the healing process. We typically use a occlusive product. We like to use our SOS cream, which you can purchase on your app, your Dermaspark Store app. It's a smart occlusive product. It's with ceramides. It helps occlude the area, so you're going to have a really nice healing and really reduce inflammation and any kind of chance of ill effect. So we have two different pens. We have the FreezePen and we have the CyroProbe. They both run on nitrous oxide. Both do a variety of lesions. However, the CyroProbe here has a much finer tip and comes with 4 different tips. The blue tip being the finest. It's really great if you're doing any kind of lesions around the ocular area. And again, if you're doing around the ocular area, you have to be medically directed or a dermatologist. So you have like the extra small tip, which is really good for really small vessels, medium silver tip, large tip, and extra large if you're doing something like plantar warts or if you're a chiropodist and you're working into your clinic that way. You have more functionality with this when it comes to lesion size. Because it's finer, you'll see here the average amount of lesions per cartridge is a little bit more. It's 6 to 12 because we don't waste any gas because the tip's finer. So the CyroProbe, you can get 6 to 12 lesions per cartridge. You have a greater variety of tips. The tips are autoclavable, by the way. So even though they look like a plastic material, you can put them in for sterilizing. You can autoclave them. The FreezePen only has 3 tips. 3 tips, though, still gives you a wonderful range for lesion removal. It's great for skin tags, etc. And because the tip size is a little bit bigger, you're going to be getting 4 to 8 lesions with this particular device. Now, I'm always cautioning people because when you first get it, you need to create, have some skills when you're doing it. You waste a lot of gas when you first start using these, just because you're unsure of timing. You might do an extra spray or etc. I just found when I was first trained on it, I went through a lot of gas immediately. But as you progress and you increase your skills, you use a significantly lot of gas. So a lot of times your 4 to 8 might be 6 to 12. And the other would increase as well just because you're better at doing your treatments. So those are our 2 devices. I'm going to show you how to load the device and what to look for when you're adding your cartridge to your pen. So I'm going to load the CyroProbe, and I've already let go of all the gas, so it's not going to have that big combustion pop that you normally get. Normally when my pen is empty, it's not spraying cold anymore, I press this down to release a lot of the compression, so when I'm opening it up, it's not such a scary event because they can sound quite loud when you are they sound quite loud when you take the gas out. So here, I see my gas here. I am going to remove it. Always check in here. Sometimes there's a little white filament, which is a piece of paper from the filter that gets stuck in there. And if you put another gas container in, it's very hard to spot sometimes because it is white and a silver background. Just always make sure, give it a little tap, look in there, make sure that the area is clean, and you will be ready to load your pen. So I'm going to get gas, and one of the benefits also with the CyroProbe versus the FreezePen is the CyroProbe has this, it can take a 16-gram gas cartridge, which is this, or I can put this inside and load an 8 gram. Why is that convenient? Because if I'm using an 8 gram and I'm only doing a couple of lesions and it might be sitting for another week, I don't have to put a whole large gas amount in my pen. So I am going to open this up, use my tweezers, and I'm going to extract this, and I am going to gently place it inside, and that little end is what's going to puncture my gas canister. And I'm going to take my gas canister, I'm going to place it here, and I'm going to place the rest of my pen on, and I'm going to just get it nice and tight like this, just fingertip tight, and I'm going to keep my pen downward because if you're going to puncture and break the seal this way, what would happen is you could end up having your gas leak. So I'm going to keep it downward, and I'm going to do 3 really quick little circular motions here as fast as I can, and you're going to hear a puncture. You hear that pop? Maybe not on screen, but I just broke the seal and my canister is ready to use. Now we have to remove the tip. And you can see how fine the CryoProbe tip is. And we are ready to go. What I always suggest is before you even treat a person, I get my FreezePen. I loaded this FreezePen too. It loads the very same as the CryoProbe. And I practice right on my catalog. So to do a lesion of this size, you'd be just doing like a nice circular pattern like this to fill in all your colors. And you would, depending on the depth, which you'd have to refer back to your training manual, you'd do a 3-second flow to maybe even a 10-second flow, depending on the depth of the lesion that you're treating. So it's always really nice practice just to get good. If I'm doing something fine like that, I'm gonna pull back, and you can see how small my little dot is for this lesion. If I'm doing a larger lesion like this size, I'm gonna do more circular motion to fill it all in. Typically, you're doing 1 pass, allowing it to thaw out for a few seconds, and then hitting it again and doing 2 passes. And of course, in your book, it will show you your freeze thaw cycles and how many seconds to hold the gas out depending on the lesion. So here, for instance, small lesion, I'm going to go in, and to keep it on, I'm going to retract my needle a little bit. And I'm just gonna hold it here for like 3 or 4 seconds if it was a skin tag, and then I'm gonna let it thaw out, and then I'm gonna hit it again as soon as the snow is gone, and I'm gonna do that usually for about 2 treatments, and then I'm done. So if that was on a human, that would be a treatment. If something's a skin tag, often I get a card or piece of plastic that I've sanitized, and I put it underneath the skin tag, and I sort of angle it down like this, so any extra gas flow goes on the card, not on my patient. So that way I'm protecting the healthy skin and just hitting the gas on the lesion itself. So I'm always suggesting go to your training book, not just for the guide on how long to flow your gas, but also to practice. You can practice quite a bit on the lesions available in your book, and then practice on friends and family. I think almost everybody has skin tags to practice on before you start using this on patients. This little angioma on the nose, for instance, be very easy to treat like this. You're just flowing it, and then you're going to let it stop, and then those type of lesions are usually actually a longer flow. And if your treatment is unsuccessful, it's because you're not holding the gas long enough. If they say 3 seconds, count 3 seconds, not 1, 2, 3. It's 1, 2, 3. Okay, so if it's a lesion that's worth 8 seconds, that's a long time. 1, 2, 3, 4, 5, and you're going to be letting your gas flow for that entire time. So don't over-treat, especially at the beginning, because you can end up causing a blister, etc. I would rather tell the client at the beginning or the patient at the beginning that you might have to come in for a second treatment for a top-up. I usually would time that maybe 3 to 4 weeks afterwards, and if there's any residual treatment left or any kind of lesion left, then you can hit it again then. For aftercare, you are going to use our SOS cream, which is our Smart Occlusive product. It has ceramides in it. It helps heal the skin and create a really nice barrier. Please do not irritate the area by scratching it. Sometimes it gets itchy when it's healing. So please do not do that. Just add a little bit of film morning and night or as needed to create that barrier until it heals. Always make sure that you've alcoholed the area prior to treatment. Make sure it's nice and clean. Make sure it's dry, and then go ahead and treat your lesions. And that is 2 lesion removals. That's going to get up. You can already see the color picking up already. This will get darker too. They'll flake off in a couple of weeks and no more spots.